Welcome to Suhail's Paramedical and Nursing Academy. Today I am going to explain about the important lecture in pharmacology. In pharmacology, one of the important lecture is that is anti-cancer drugs. Today I am going to explain about the anti-cancer drugs. In anti-cancer drugs, first of all, in pharmacology, I am going to take anti-cancer drugs. Remember one thing, these lectures will be helpful for those who are paramedical students or nursing students or diploma students. Remember the thing that in these lectures I have taken the concise material. The concise material in the sense, if you open the books, if you open the pharmacology books, different authors have written different material. And in drugs also there is confusing in the drugs. There will be different types of drugs present in the different books. So what I have done that I had taken those drugs which are the common, and only those drugs I have taken which will be helpful for the nursing student, mostly nursing students. So the thing is here that I am going to explain about the anti-cancer drug. Anti-cancer drugs. What are the anti-cancer drugs? We all know, first of all, we should know the basic. We should know. Suppose we are going to give the drugs for cancer, anti-cancer drugs, the drugs which are used against the cancer, which are used against the drugs, which are used against the cancer. So what are the drugs which are used against the cancer? So we will explain that. The thing is, first of all, what is cancer? So cancer, remember, there are two, sometimes it is confusing. There are two terms. One is called a neoplasm. The neoplasm means there is abnormal growth of cells, uncontrolled growth of cells. Even after the stimuli, the external stimuli is removed, there will be still growth, still uncontrolled growth of cells. That is called a neoplasm. So in neoplasm, it is also called as tumor. So tumor is a one term, that is called tumor. So in tumor, remember the thing that the tumor may be benign, it may be malignant. The benign tumor is present in its localized space, in its particular space. So it is called as benign tumor. Another is called benign tumor. Another is called malignant tumor. Malignant tumor is another type of tumor. Remember, the malignant tumor is called as cancer. Remember the term, benign tumor is not a cancer, malignant tumor is a cancer. Because in malignant tumor, what will happen? It will not be localized. It may do metastasis. It may do local invasion, or the cells may do metastasis. Metastasis means they will move from one tissue, one organ towards the other organs through blood, through lymph or other transporting system. And so this is called cancer. So cancer is a malignant tumor. Cancer is a malignant tumor which can show local invasion or which can show metastasis. So that is the term that I have told about the basic. So now I am telling about the anti-cancer drugs. So what will be our aim? The aim of our anti-cancer drugs will be that we are going to destroy the cancer cells. We are going to destroy the cancer cells. So how we will destroy the cancer cells? Remember, the cancer cells can be destroyed by different means. We can attack the DNA of the cancer cells. We can attack the metabolites of the cancer cells. We can attack the DNA of the cancer cells. We can attack during cell division. I already told, during cell division there will be formation of microtubules and microfilaments when there is separation of DNA during the anaphase. So we can use those substances which can prevent the microtubule formation. So I will explain one way. So there are different types of So the first of all, we have to remember classification of anti-cancer drugs. In classification, I will tell the first classification is alkylating agents. Second is microtubule damaging agents. Third is antimetabolites. The fourth is platinum coordination complexes. Another one is topoisomerase inhibitors. There are two types of topoisomerase inhibitors. One is topoisomerase inhibitor first and topoisomerase inhibitor second. Another is antibiotics, and then hormones. There are some miscellaneous also. I have not included. I have taken this classification, and this is a simple classification. Remember, first of all, I will tell the names of drugs. Then, during the mechanism, you will understand what actually they are doing. The first thing is that is alkylating agents. The alkylating agent, there are two drugs which are coming in the classification of alkylating agents. One is cyclophosphamide. Another is a phosphamide. Cyclophosphamide another is a phosphomide. Then there is microtubule damaging agents. Those drugs which damage the microtubules, they are vincristine. There, one example I have taken here, there is vincristine. There are different categories here. If you open the books, if you open the pharmacology books, there will be different classification in this also. But I have taken simple drug that is vincristine, which comes under the category of vinca alkaloid. Because it has a natural origin. It has a natural origin. That is why it's called as vinca alkaloid. Vincristine is the example of vinca alkaloid, vincristine drug. Okay, and there is antimetabolites. In antimetabolites, there are folate antimetabolites, there are purine antimetabolites, there are pyrimidine antimetabolites. So folate, purine, pyrimidine, three types of antimetabolites are there. Example is given for each. Folate antimetabolites, methotrexate. Another is purine antimetabolites, 6-mercaptopurine. Another is pyrimidine antimetabolites, 5-fluorouracil. Remember, my pronunciation may be different, but you can pronounce in your own way how you want to remember. The aim is to remember the drugs. Another is platinum coordination complex. Platinum coordination complex, that is cisplatin and carboplastin. Under the platinum coordination complexes, there comes two drugs. Those are called cisplatin and carboplastin. I will tell a simple tricks later about how you can remember this. Topoisomerase inhibitors first and second. Topoisomerase inhibitors first and second. The example is etoposide and topotecan. You can pronounce different way, but I am pronouncing this way. Etoposide, topotecan. Another is antibiotics. Actinomycin D, actinomycin C. There are different types of antibiotics which are coming under the category of anti-cancer drugs. But I have taken the simple two antibiotics, actinomycin D, actinomycin C. Anyone want to remember more antibiotics can open the pharmacology books. There will be lot of examples. Another is hormones. In hormones, what we will remember? Hormones, we will give glucocorticoids, we will give androgens, we will give estrogens, which are present here. So this is the classification. So how you remember the classification? Alkylating agents, microtubule damaging agents, antimetabolites, platinum coordination complexes, topoisomerase inhibitors first and second. It is actually, this is also classification is, if you open the books, there will be topoisomerase inhibitors first, topoisomerase inhibitor second. The topoisomerase inhibitor first contains toposide. Topoisomerase inhibitor second contains topotecan. I have put only one classification here. Okay, antibiotics, actinomycin D, actinomycin C. Hormones, glucocorticoids, androgens and estrogens. Okay, so this all is the classification. Now, how you remember this classification? The best way is to remember the simple mechanism. What is the mechanism for alkylating agents? I will explain, because now I have told the classification. Now the question may come, tell the mechanism of action. You have tried. In mechanism of action, you can explain the mechanism of action only of alkylating agents. But I will tell mechanism of action many of these. Okay, so alkylating agents, what they will do? The alkylating agents are those agents which will do alkylation. They are called as alkylating agents. What actually happens? This is the DNA. This is an DNA, one strand, another strand. Okay, this is the DNA. I am telling the mechanism of action. Remember, alkylating agent, suppose phosphomide is there, a phosphomide is there. What will do cyclophosphamide? What it will do? It is an alkylating agent. The alkylating agent will produce carbonium ions. Now you will think, what is carbonium ion? Carbonium ions are, suppose C positive is an carbonium ion. It is a carbon, but carbon is having positive charge. These carbonium ions will be produced by the alkylating agents. Okay, this much is simple. It will produce carbonium ions. These carbonium ions have capability. What capability they have? They will do what? They will do cross matching here. Abnormal cross matching within the DNA. So this is the DNA which is present in the cancer cell. In this DNA, we all know there will be adenine, one strand, two strands. Adenine will be, whose normal rule is adenine, guanine, cytosine, thymine. The normal rule is that adenine will combine with thymine. Normal rule is cytosine will combine with guanine. Normal rule is cytosine will combine with guanine. Thymine will combine with adenine. This is the normal rule. But here what will happen? Actually there was adenine, cytosine, adenine. Okay. So I will write on the by another pen. It will be simple. See, here was adenine, cytosine, adenine. Suppose in the DNA. Here will be adenine. I told you there will be thymine. In case of cytosine, there will be guanine. Here will be thymine. Normal rule. And there will be double bond, double bond. Here will be triple bond, triple bond. Okay. Here will be double bond, double bond, double bond, triple bond. Okay. Double bond, triple bond, double bond. What will happen? I am telling the mechanism very broad so that you will explain. Otherwise, you can write simple. I will tell what you will write. Here, one bond, double bond. These bonds are called as hydrogen bonds. These are not the covalent bonds. These are hydrogen bonds. If you know the chemistry, you can easily explain here. See what will happen. What these carbonyl ions will do cross matching between guanine and adenine. This is abnormal cross matching. They can do cross matching between the same strand, that is guanine to thymine, guanine to adenine, guanine to thymine. They have done the hydrogen bonding. This is because of the production of carbonyl ions by alkylating agents. What happened? There was cross matching. There was cross matching, abnormal cross matching between the bases. The bases are adenine, guanine, cytosine, thymine. This is the normal rule, but there is abnormal base pairing. This abnormal base pairing will destroy the DNA. So there will be no further DNA replication. When there is no further DNA replication, no further cells will be produced. The division of cancer cells will be stopped, and also the cancer cells who are having this kind of abnormal base pair matching will be destroyed within the cells. Remember this thing. That is called as, this was the mechanism of alkylating agents. Simple. Alkylating agents will produce carbonium ions. Carbonium ions will do abnormal or we can say mismatching of nitrogen bases. What are those nitrogen bases? Adenine, guanine, cytosine, thymine. And what is the normal rule? This is the normal rule. Adenine, guanine, cytosine, thymine. Adenine, guanine, cytosine, thymine. But here these two will combine. This is the normal rule. But here will be abnormal cross matching, abnormal base pair matching. This is done by alkylating agents. Suppose second is microtubule damaging agents. Microtubule damage, what we will do? We all know during the cell division microtubules will be produced. Okay, these drugs will inhibit the arrangement of microtubules. When microtubules are not arranged, there will be no separation of DNA. When there is no separation of DNA, the cell will not further progress in the cell division. The cells will be destroyed. That is the role of microtubule damaging agents. Remember, I have already told this in the cell cycle. In cell cycle, when I was studying cell cycle, already I have told there will be formation of microtubules which will help in the separation of DNA. So that DNA will be inhibited by microtubule damaging agents. Another is antimetabolites. Antimetabolites are those which will act against the metabolites of the cell. What are the metabolites which are present in the cell? Remember, there is one. Suppose these are the drugs, folate antimetabolites. Those metabolites which act against the folate, because folate is used for the synthesis of DNA. Okay, folate is used for the synthesis of DNA. The drug is methotrexate. Purine antimetabolites. The purine antimetabolites, the example is 6-mercaptopurine. They will inhibit the purine bases. They will what? They will act against the purine bases. What are those purine bases? They will act against the purine bases. What are those purine bases? I told adenine, guanine is an purine base. Then there is pyrimidine antimetabolites. Pyrimidine antimetabolites, example is 5-fluorouracil. 5-fluorouracil. So these are the mechanism of these three, how they are acting. Simple mechanism I am telling, not the broad mechanism. Platinum coordination complex. Another is platinum coordination complex. The example is cisplatin, carboplatin. How they will act? So we have studied in the chemistry, there is a coordination chemistry. In coordination chemistry, we are knowing that platinum forms coordination compounds. Platinum is an element. It has the capability to form coordination complex. What is coordination complex? Then you have to enter into the chemistry. I will not go towards that side, but I will say platinum forms coordination complexes. Those coordination complexes, example cisplatin and carbaplastin are the two platinum coordination complexes. They will do what they will do. They will join with, they will cross link with the DNA. They will join with the DNA. They will cross link with the cancer cell DNA. And what will happen? The cell will be destroyed. There will be no division in case of cells. But the main mechanism you have to remember in the alkali agent is this. This is not all. It is not important. You should remember for all, but for your purpose, you can remember platinum coordination complex also. And this topoisomerase inhibitor. Example: etoposide, topotecan. So these topoisomerase is an enzyme which is found in our cells. So what will happen? Topoisomerase inhibitors. What they will do? They will inhibit the topoisomerase enzyme. Because these topoisomerase inhibitors are important during the cell division and cell cycle. Okay, for the normal DNA replication, transcription, translation that we are studying. Antibiotics we know actinomycin D, actinomycin C. Now I will ask one question for you all. You have to write in the comment, or you have to say in the Instagram group that this what, why antibiotics are being used in case of anti-cancer drugs. First thing, why hormones like glucocorticoids and estrogens are used in case of anti-cancer drugs. I will not tell the mechanism of these two. Just you can open the sources. You can open the different internet sources. You can find what antibiotics will do, what hormones will do. Okay. But I will hear one term. I will say that in case of hormones, glucocorticoids will do what? It will do. It is an lympholytic. It is an lympholyte. It will destroy the lymphocytes. That is why it will be used in case of. See, what are the different types of? It will be used in case of which cancers this will be used? Glucocorticoids. I will tell example. Suppose it will be used in case of lymphoma. Okay, it will be used in case of leukemia. Lymphoma and leukemia are the two, lymphoma and leukemia. These are the cancers. What will happen? That glucocorticoids will be used for these kind of cancers. Why? Because there will be excessive production in leukemia. There will be excessive production of abnormal lymphoblasts. Whether it is an erythroblast, whether it is an erythroblast, megakaryoblast, or any other abnormal cell, any other immature cell. Those immature cells are produced in case of leukemia. So what will happen? That glucocorticoids will be used to destroy those cells within the body. That is why, remember one more thing, those who are taking these glucocorticoids, in case of these two, we are giving in case of lymphoma and leukemia patients, there will be excessive breakdown of the cells within the blood, that is lymphocytes. What will happen? The excessive breakdown of lymphocytes what will happen? There will be excessive production of uric acid. Excessive production of uric acid will be within the body, and that may lead to the formation of gout-like situations will be there. So what I was saying, this was the mechanism how they will act. Once more I will tell what are the cancers different. Suppose which cancers we can use this. You can take the screenshot, or it is screenshot will be also available in the Instagram Suhail's Paramedical and Nursing Academy. There also it will be there screenshot of this. I will tell here what are there are different types of cancers. We can use leukemia, lymphoma, breast cancer. Okay, breast cancer. The different types of cancer there: leukemia, lymphoma, breast cancer, non-Hodgkin's disease. These are the different diseases why we are using these anti-cancer drugs. Now the thing is, I have explained this a simple mechanism. Now that this antimetabolites, how these antimetabolites will act, I already told. Suppose these are folic antimetabolites. These folic antimetabolites will what they will do? They will inhibit the formation of what? Tetrahydrofolic acid. Because what will happen? I will tell him. I think mechanism of this also I will explain. 1 second, you have to wait. 1 second. See here. What will happen? I will tell here. Okay. You can see here. See. Actually, there is an folic acid. The folic acid will be converted into dihydrofolic acid. hydrofolic acid. Dihydrofolic acid will be converted into tetrahydrofolic acid, which will be used for the formation of the DNA. Okay, what will happen? There is an enzyme that converts dihydrofolic acid into tetrahydrofolic acid, that is called dihydrofolate reductase. Dihydrofolate reductase. This enzyme will be inhibited by these antimetabolites. The simple thing. You can open from there, you can see in the books also how it is acting. Now, this was mechanism of action. What are the uses? The uses I told, these are the different types of cancers. While we will use this leukemia, lymphoma, breast cancer, non-Hodgkin's disease, the different types of cancers are there. That will be the uses. Now, what will be the adverse reaction? If we are giving these drugs, what will be the adverse reaction? One of the main adverse reaction will be bone marrow suppression. Bone marrow suppression. It will suppress the bone marrow. When bone marrow will be suppressed, what will happen? This is also called as adverse reaction. You can, if the question is asked, toxicity of the cancer drugs. In toxicity of cancer drugs also, you can write this all. If there is written adverse reactions, you can write this all. Okay? 1 second. Okay, I was seeing whether recording is going on or not. So what will happen? I told bone marrow suppression. When bone marrow will be suppressed, the function of bone marrow will be suppressed because of these drugs. When these drugs are taken into excess, or when long-term drugs are being taken for cancer, what will happen? Bone marrow suppression will be there. When bone marrow function will be suppressed, there will be what will happen here? There will be less production of bone blood cells. There will be less production of blood cells. That is why there are chance of what? Loss of blood. There will be chance of bleeding in the body because of bone marrow suppression. Because the less platelets will be produced from the bone marrow. When there is less platelets, there will be bleeding within the body. Another is immunosuppression. It will do the immunosuppression. The drugs will suppress the immune system. So immunosuppression. That is why there will be the what? Infections. Those are called as opportunistic infections. The opportunistic infections are their chances that are because of fungi, because of bacteria, because of virus. Due to the immunosuppression is a side effect of anti-cancer drugs. Another is oral infection. In oral infection, what we have to do? There will be the stomitis infection. There are chances of stomitis infection. That is stomitis is an inflammation of oral cavity. Oral cavity, there will be this inflammation. There will be infection within the oral cavity. Inflammation within the oral cavity. Those are the oral infections. In the GIT, gastrointestinal tract, we all know. If you don't know any adverse reaction, at least you should write there is nausea, there is vomiting, there is diarrhea, there is gastrointestinal bleeding. That is the GIT adverse reactions. What will happen in the skin and hair? Alopecia, loss of hair, that is called alopecia. Dermatitis, there will be infection, skin infection, that is called dermatitis. These are the side effects. Another is teratogenic effect. In teratogenic effect, what will happen? The drugs will act as teratogens. These anti-cancer drugs may act as teratogens during the pregnancy period of the mother. What will happen? These drugs may cross the placenta. When these drugs will cross the placenta, they may cause any abnormal change within the fetus. That effect is called teratogenic effect, and the effect is called teratogenic effect, and those drugs are called teratogens. So one thing you remember, it is a contradiction that we should not give anti-cancer drugs, particularly during the pregnancy. Okay, this you remember. Another is gonadis. Side effect is teratogen. Another is gonad effect. There will be oligozoospermia. That is less production of sperms. Less volume of sperms will be there. That is oligospermia. There is infertility in case of males or females. There will be in chance of infertility in case of males or females. Or there is another thing, that is hyperuricemia. Hyperuricemia means there will be high uric acid within the blood. That may cause the chance of, there will be the chance of gout. I already told why there is hyperuricemia. It is because of the glucocorticoids. That already I have told. This was the adverse reaction. And now the thing is, there are a lot of things in the books. You can see 4 pages will be written for the anti-cancer drugs only. But the thing is, I have taken the concise material. the drugs, the classification, the mechanism, then adverse reactions, the uses are here. What are the different types of cancer? This is the use. Or if the question is asked toxicity, you can write the adverse reaction. What I have told you here. This is toxicity. Okay. The thing is, one more thing is how you remember these drugs. Once more, you can remember alkylating agents, microtubule damaging agents, antimetabolites, platinum coordination complex, topoisomerase inhibitors first and second, antibiotics and hormones. And if there is any, I will check whether if there is any kind of mnemonic for this. I will tell mnemonic also how to remember the class.